Healthcare billing and medical coding rules are in a constant state of flux. Providers using outdated methods of collection and claim denial management will struggle to maximize revenue and cope with the demands of insurance companies that often have different payment rules and regulations.
So the main reason why insurance regulations keep changing and billing guidelines change is to keep up with advancements in diagnostic technology. So for example, during the peak of COVID in 2020, people were not visiting doctors, but they still needed to receive urgent and routine care. And so insurance companies had to relax the telehealth billing rules in order for patients to receive care via telehealth environments and for providers to get paid. And so Alpha II software, we made changes on a daily basis to keep up with the changes in the billing guidelines for the changes in the telehealth billing requirements.
Society is more technologically advanced than ever. Using innovative solutions not only enhances patient care, but also streamlines the service provided by healthcare providers. Effective technology solutions make healthcare more efficient and profitable.
For a large physician practice, it would be virtually impossible for providers to get paid properly and to bill, given the complexity of the billing and coding guidelines. And so really that's where Alpha II comes into play. We provide software that enables providers to accurately code and counter visits and to bill the insurance companies that they deal with. In some cases, they deal with dozens, and if it's a large physician practice or a hospital system, it can be hundreds, literally hundreds of different insurance companies that they have to deal with on a daily basis.
Imagine life without technology. Technological advancements have not only facilitated a move away from manual completion of tasks, but have really upgraded the healthcare system and simplified the daily tasks of clinical and non-clinical teams. Alpha II's software solutions support the healthcare business model. Industry trends indicate 90% of denied claims are preventable. Alpha II's extensive claim edit library allows coders to make real-time decisions that will reduce costly denials on the back end. Alpha II and Greenway Health ensure mutual success, leveraging each other's technology to provide a strong revenue integrity solution for their clients and end users.
The current healthcare environment is incredibly complex for physicians to navigate. The notion of physician burnout is one that's getting a lot of attention right now. And there's several drivers for that, two in particular that I think are important. One is related to policy and the regulatory pressures that are on providers today. About 10 years ago, the HITECH Act really pushed electronic health records onto physicians, and the result of that is in a decade, the entire industry moved from paper now to electronic health records. And that's a great thing for the industry, but for providers today, they spend about 2 hours a day documenting in the EHR, and that's time that takes them away from interacting with the patients that they're caring for. Another challenge for healthcare providers is related to payment reform, particularly this shift towards value-based payment that is putting more financial pressure than ever on providers and making it challenging for them to navigate this complex environment. So some examples of that are changes in billing rules and requirements, changes in different services that providers are able to get reimbursed for. And that's where Greenway is really helping providers to navigate that revenue cycle environment, and we're doing that with many of our industry partners like Alpha II.
With over 55,000 healthcare providers, Greenway Health delivers client-driven healthcare technology solutions. They provide electronic health records, or EHR, practice management, and revenue cycle management solutions that drive successful providers, empowered patients, and healthier communities. Alpha II and Greenway Health work together to build upon continued innovation and value. This partnership, lasting over 20 years, provides clients with billing expertise, consultation, and insights for achievement of a practice's financial goals.
In healthcare, we're all dedicated to one single thing, and that is to improve patient care and provide the best patient care that we can. And there's a clinical aspect to that, but there's also a non-clinical aspect to patient care. And when we talk about technology, especially in the revenue cycle space, we think about what is that doing and how is that impacting the patient? Well, it removes administrative burden from the clinician. It allows the hospitals and the providers to get paid quickly. But one thing it does is also allows for denial prevention, revenue retention, but also revenue growth. And there is a ripple effect, right, to healthcare on the non-clinical side. So you have the patient, and if the patient has a bad non-clinical experience when it comes to their bills or whether it comes to their education around their care, and the people that are taking care of them are also impacted. So technology in our space is extremely important to provide efficiencies, right? It's to remove the administrative burden of our clinicians and our healthcare leaders. But we all have the same thing in common. We all want to provide exceptional patient care because we get to help others. And that's the whole reason why we're all in healthcare, regardless if you're on the clinical or non-clinical side. Alpha II is committed to education. We have so much knowledge here, and it was important for us to provide education to healthcare communities across the country. On an annual basis, we provide healthcare education to over 15,000 registrants, really focusing on medical necessity, the ever-changing environment when it comes to coding and billing. And why that's important is that we help these leaders and this non-clinical team on revenue cycle make sure that they have the education so there's not mistakes made downstream. And so that helps improve patient care because the billing and the coding and everything else that they have going on, they're not going to feel those effects. And we're going to make sure through this process that our healthcare providers are getting paid what they should. And so through our education, which is no cost, we not only provide education to physician groups, but also to acute care facilities and large healthcare systems. So our dedication is paramount. In addition, we are the leader in the revenue cycle technology. That's why so many people come to us for our education at Alpha II University. But on top of that, it's really providing that no-cost resource to make sure our communities are up to date on everything we have going on in the ever-changing healthcare industry.
I'm not a doctor, I can't do any surgical procedures, and nobody would want me operating on them. But I can certainly, look through the billing guidelines and the Medicare guidelines and help hospitals, receive the reimbursement that they're entitled to.
Healthcare billing and medical coding requires precision and accuracy. Outdated methods of revenue management are no longer a viable option for providers. Alpha II provides technology solutions that address the unique billing and coding requirements across the full continuum of care. To learn more, visit us online at alphaii.com.